Every year, millions of older adults go for routine health checkups, believing they're making the right choice for their well-being. But what if I told you that some of these very tests could actually increase your risk of a stroke? Almost overnight? Hard to believe, isn't it? You trust your doctor. You follow every piece of advice. Yet, hidden in the fine print of modern healthcare are quiet dangers that no one talks about. Not the media, not those glossy clinic brochures, and sometimes not even your physician. Picture this. You leave your yearly checkup reassured everything's fine, only to feel dizzy, experience blurred vision, or worse, within a few days. And you're left asking yourself, what just went wrong? Here's the reality. Certain diagnostic procedures, particularly when repeated too often or performed under specific health conditions, can silently cause blood pressure spikes, disrupt circulation, and even spark a chain of events leading to a stroke. But don't panic. This video isn't here to frighten you. It's here to give you the knowledge to ask smarter questions and take steps to safeguard both yourself and your loved ones. Because after 60, staying healthy isn't just about catching problems early. It's also about preventing new ones we might trigger by mistake. Over the next few minutes, we'll break down 5 common medical tests that can carry hidden stroke risks for seniors. More importantly, you'll discover how to stay safe before your next doctor's visit. If you're over 60, drop a 1 in the comments. If you're not, type 0, and don't forget to subscribe to Health 180, where we share what others won't tell you. Now let's dive into the first test you may want to think twice about. If you've ever had a CT scan with contrast, you probably recall that warm, almost flushed sensation spreading through your body. That's the contrast dye at work, helping doctors get a clearer view of your blood vessels, organs, and tissues. Sounds beneficial, right? But here's something many seniors are never told. That same injection can do more than sharpen the images. It can silently put added strain on your heart and blood vessels, especially if you're over 60 and already managing high blood pressure, heart disease, or kidney issues. In some cases, contrast dye can trigger what's called a vasovagal response, where your heart rate and blood pressure drop suddenly. This may leave you feeling lightheaded, nauseous, faint, or even briefly unconscious. But in others, it does the opposite. Blood pressure can surge, and fragile blood vessels may tighten or spasm. When that happens, the chance of a stroke or cardiac episode quietly rises. A study in the Journal of Vascular and Interventional Radiology reported that older adults receiving contrast-enhanced CT scans faced a higher rate of vascular complications within 72 hours, especially those with prior hypertension, cardiovascular problems, or weakened kidney function. The takeaway? The more vulnerable your body's systems are, the higher the risk from contrast dye. Here's a real-life story. An 81-year-old gentleman went in for a routine abdominal CT scan because of mild digestive discomfort. The scan came back normal, and he felt fine when sent home. But 2 days later, he experienced a minor stroke. The likely culprit? A temporary spike in blood pressure from the contrast injection, which may have caused a clot to block blood flow in his brain. Now, this isn't to say CT scans with contrast are bad. On the contrary, they can be life-saving for detecting cancers, blood clots, and aneurysms. The key is using them wisely, not as a just-in-case test during routine checkups. So, how can you protect yourself? Before agreeing to a contrast CT scan, ask your doctor, is this test truly necessary, or is there a safer alternative for my age and condition? Be sure to share your full medical history, especially if you have hypertension, kidney issues, heart disease, or prior reactions to contrast or other medications. And don't hesitate to ask, could this be done without contrast? In some cases, a non-contrast CT or an ultrasound might give enough information without added risks. Up next, we'll look at another common screening seniors often undergo, even when they feel perfectly fine. That might not be as harmless as it sounds. Now, let's discuss the stress test, often called an exercise stress test. On the surface, it seems like a smart preventive measure. Strap on a heart monitor, step onto a treadmill, and check how your heart performs under pressure. But if you're over 60, especially with high blood pressure or heart disease, this seemingly simple test could carry unexpected risks. Here's why. During the test, you're asked to walk or sometimes jog while technicians monitor your heart's response. As the treadmill speeds up, your heart rate climbs, your blood pressure rises, and suddenly your cardiovascular system is under significant strain. For a healthy younger person, this might not pose much of a problem. But for seniors with existing conditions, it can be like striking a match in a dry forest, potentially triggering dangerous outcomes. What kind of risks? They include sudden spikes in blood pressure, abnormal heart rhythms, arrhythmias, and in rare but documented cases, small tears in delicate blood vessels in the brain. A 2020 study published in the American Journal of Cardiology followed over 1,300 seniors aged 65 and up who took treadmill stress tests. Nearly 7% experienced adverse events during the procedure, such as surging blood pressure and irregular heartbeats. And who was most at risk? Those with pre-existing vascular issues. This isn't just a theoretical concern. Take Margaret from Ohio, one of our viewers. At 74, she had long battled high blood pressure. Her doctor suggested a stress test as a precaution. Midway through the treadmill session, Margaret felt dizzy and complained of chest tightness. The test was stopped immediately, but the next day she suffered a minor stroke. Doctors suspect that the rapid rise in her blood pressure during the test ruptured a tiny vessel in her brain. To be clear, the stress test didn't directly cause the stroke, but it placed stress on an already fragile system, tipping the balance. So, what's the lesson here? Have an open discussion with your doctor. Ask, is there a safer way to assess my heart? For many seniors, a pharmacological or nuclear stress test, which uses medication to mimic exercise, or a resting echocardiogram may be safer alternatives. And if you're not currently experiencing symptoms like chest pain, fatigue, or breathlessness, consider whether this test is urgently needed or if it can be delayed. Next, we'll look at another seemingly routine screening that could bring hidden dangers for older adults. Let's move on to a test that's become almost a ritual after turning 60, the endoscopy. Whether it's to examine your esophagus, stomach, or colon, doctors often suggest it as a precaution. And in some cases, it's absolutely the right call. But here's what isn't often discussed. If the procedure isn't truly necessary, and especially if sedation is involved, it could carry hidden risks. Here's why. Many seniors take daily medications, including blood thinners like aspirin, Plavix, or warfarin. During an endoscopy with sedation, your blood pressure and circulation naturally fluctuate. Combine that with medications that reduce your blood's ability to clot, and the risk of internal bleeding or reduced blood flow to the brain quietly rises. In 2021, a major review published in Gastrointestinal Endoscopy examined outcomes for patients over 65 undergoing sedated procedures. It found a noticeable uptick in transient ischemic attacks, or TIAs, often called mini-strokes, within 72 hours post-procedure. Though these weren't full-blown strokes, they were red flags. Each TIA signals a brief interruption in brain blood flow and raises future stroke risk. Take the case of a 76-year-old woman who went in for a routine colonoscopy with sedation. She felt fine at first, but 2 days later, she began slurring her words and struggling with balance. At the hospital, tests confirmed a mild stroke. Doctors suspect the drop in blood pressure during sedation, combined with her daily aspirin, may have created the perfect conditions for a clot to form and travel to her brain. Even when the procedure itself is considered low risk, the combination of age, sedation, and certain medications can create a dangerous mix. Now, does this mean endoscopies are bad? Absolutely not. They're powerful tools that can save lives when truly needed. But it does mean you shouldn't agree to one unless your doctor can clearly explain why it's essential right now. If it's suggested just because It's been a few years. Ask whether less invasive monitoring options exist, especially if you aren't experiencing symptoms. Always let your doctor know about all medications you're taking and ask, will I need to pause my blood thinner beforehand? What are the sedation risks for someone my age? And if you're concerned about sedation, ask whether the procedure can be performed with minimal or no sedation. Next, let's look at a test that doesn't get much attention, but involves something we rarely think about: our kidneys. MRIs are incredible diagnostic tools. They let doctors see deep inside your body, detect early problems, and sometimes even help you avoid unnecessary surgeries. But when contrast dye is used, usually to sharpen the images, that's when older adults need to be especially careful, particularly if there are any hidden issues with kidney health. The contrast dye for MRIs often contains gadolinium, a heavy metal. Normally, it's supposed to pass quickly through your system, filtered out by your kidneys. But here's the issue. After age 60, kidney function naturally slows, and if you already have undiagnosed chronic kidney disease or reduced function, your body might struggle to flush out the gadolinium effectively. This can leave trace amounts behind, and over time, those traces may cause trouble. Retained gadolinium has been linked to a rare but serious disorder called nephrogenic systemic fibrosis, NSF. This condition leads to hardening and tightening of the skin and connective tissues, sometimes even restricting movement, breathing, or affecting internal organs. There's more. Studies have found gadolinium deposits in brain tissue. While research is ongoing, some experts believe this may contribute to subtle neurological symptoms like dizziness, confusion, and balance issues, especially in those already vulnerable to circulatory problems. One study in radiology, 2019, followed over 2,000 patients aged 65 and older who had MRIs with contrast. Within a week, about 5% reported stroke-like symptoms, headaches, vision changes, balance difficulties. These weren't full strokes, but warning signs that something wasn't right. Take Harold, a 79-year-old veteran from Arizona. He went in for an MRI to investigate back pain. His doctor ordered it with contrast, just to be thorough. Harold didn't know his kidneys were already compromised. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lasted nearly a week. Later, a routine lab test revealed stage 3 kidney disease. "No one warned me," he said. "Had I known, I would have asked more questions." So, what can you do? If a doctor suggests a contrast-enhanced MRI, ask, "Can this be done without contrast?" Often, the answer is yes. If contrast is truly necessary, request a simple kidney function test first, a blood test called a GFR. It takes minutes and can prevent serious complications. Also, let your doctor know if you've ever experienced odd reactions to imaging tests before. Remember, MRIs themselves aren't the problem. It's how your body handles the added chemical. With smart precautions, you can still get vital answers while protecting both your brain and your kidneys. Now let's shift to a test that seems completely harmless, even a smart choice to do regularly. But for many older adults, it could set off a chain of unnecessary and risky procedures. The routine carotid artery ultrasound. This test is quick, painless, and doesn't involve needles, contrast dyes, or noisy machines. On the surface, it sounds like the perfect preventive measure. But here's what many people over 60 aren't told. If you have no symptoms and your doctor orders this scan just to be safe, it might actually lead to surgeries you never needed and expose you to risks you weren't prepared for. Your carotid arteries are the major highways delivering blood to your brain. Over time, they can develop some plaque, tiny buildups of cholesterol or calcium. That's a normal part of aging. But not every plaque is dangerous, and in many cases, leaving it alone is actually safer than intervening. Here's how problems often begin. Imagine you get a carotid ultrasound and it shows a 50 to 60% narrowing. That sounds frightening, right? You're referred to a specialist, And suddenly there's talk of procedures like carotid endarterectomy or stenting. But here's the key. If you've had no warning signs like dizziness, vision problems, or weakness, these procedures often provide little extra protection, and they come with their own serious risks. A landmark study in the New England Journal of Medicine tracked more than 3,000 seniors with moderate carotid narrowing, but no symptoms. The results? In most cases, surgery didn't significantly lower their stroke risk compared to medication and lifestyle changes alone. Worse yet, some patients suffered strokes during or soon after the procedure, complications that might not have occurred if they had chosen observation over surgery. Consider Helen's story. She was 82, feeling perfectly healthy when her doctor ordered a carotid ultrasound just to be thorough. It revealed 65% narrowing. Within weeks, she underwent surgery. Tragically, she suffered a small stroke during the procedure. Helen survived but now has weakness on her right side. "No one told me I might have been better off doing nothing," she said. So, how can you protect yourself? If a doctor recommends a carotid ultrasound without any symptoms, ask, "What will we do if something shows up?" And, "Will this scan change my treatment plan?" If you're already managing your blood pressure, cholesterol, and following a healthy lifestyle, an extra test may add little value. And if a scan has already shown some narrowing, don't panic. Ask whether it's safer to monitor the situation with periodic scans rather than rushing into surgery. Finally, always seek a second opinion before agreeing to any vascular procedure. Up next, let's bring it all together with some thoughtful advice and a reminder about staying in charge of your health. So here's the takeaway. Not every medical test is bad, but not every test is right for you, especially past 60. As we age, our bodies react differently. What feels routine, a contrast injection, a sedative, or even a scan, can sometimes set off a chain of effects we never expected. A harmless-looking dye might raise your blood pressure. A simple procedure might unsettle your circulation. Even a standard checkup can carry hidden risks if your system is already fragile. That's why it's crucial to slow down, ask thoughtful questions, and make sure every test is truly tailored to your situation, not just part of an automatic checklist. You have every right to ask, "Do I really need this?" Or, "Is there a safer way to get the answers we need?" Because when you're informed, you're empowered, and that leads to safer choices and more peace of mind. Your health journey is unique. Your voice matters. And here at Health 180, we're committed to helping you navigate it with clarity and confidence, not fear. Have you or someone you know ever felt strange after a test or checkup? Share your experience. Drop a 1 in the comments. If not, leave a 0. Let's start a conversation and learn from each other. And if this video opened your eyes, gave you clarity, or made you feel a little more in control, hit subscribe to Health 180. We're here to ask the questions no one else does and help you make the best decisions for your well-being.